I'm going to try to be brief because I'm one of the first people doing, answering you guys' questions. I just want to say that what Angela and Julia provided in those first two slides was an enormous gift. I feel like I have been working for like 3 years to understand and like to sort of create that mental map that they created for you guys in those first two slides. I suggest that your being here should entitle you to access to those two slides because they're really amazing. I want to use those frameworks. So first, I am studying AI in frontline work, so AI being used for patient care. It happens that in the context that I'm studying, which is a large, a tertiary I forget how you pronounce it, whatever, hospital, that some of those tools are also somewhat being used for workforce management. So it's kind of simultaneous for frontline work and workforce management. I think so. My focus is on AI tools that are not being tested, but rather implemented. And so the focus is on, I'm especially interested in implementation at scale. So, which fundamentally means looking at how models transfer, they're developed for one specific role, work group, or institution, and how do they scale up as they move from one institution to, to another, because that's supposedly the promise of AI, and it's not clear to me how easy it is to deliver on that promise. I am studying AI in teams, and Zoe Jonathan is right there. Kate Kellogg is somewhere in the back, and we're there. And we are looking at how AI transfers across provider specialty, because healthcare has very clear divisions across occupational jurisdictions, but the teams cross those jurisdictions. And so when we look at models transferring or being collectively used, it's across those jurisdictions. I am studying how, so the whole idea, as we heard from Julia, is that AIs learn, and Julia and Angela both mentioned, so AI learns. If the AI is learning, the question is, can the people learn from the AI? So is there, I think if we look at the opportunities within healthcare for there being augmentation as opposed to automation, then fundamentally it's got to be about, and also we have a real problem, at least in healthcare, of experts exhibiting algorithmic aversion, a lower likelihood of taking advice from algorithms, which we know to be generally true. So a key thing for keeping experts paying attention to AI is whether they feel like they can continuously learn from it. And Kim Asavaboken, which I know I'm pronouncing her name incorrectly, but she's up here, and we are working on a project on people learning from AI and sort of what are the conditions and what are the user interfaces and what are the, sort of all of those dynamics with sort of how do professionals learn from AI. And work that I did with Elizabeth Yang, who's at Yale, who unfortunately couldn't make it to AoM this year, was informing that research. I'm especially interested, that kind of leads into in healthcare, it is at least in the US, the #1 largest employer in terms of employing industry, number of people. It's also largest in wages, but there's an enormous problem in equity where there are low quality jobs and high quality jobs in healthcare. And this idea of AI for learning is about upskilling. So could there's currently no path for healthcare workers who are on the lower end to sort of upskill to the higher end. And there's a tremendous shortage on that in those of people doing that higher end work. And so, this issue, which is related to transferability, it is related to the learning work, is sort of how can AI be used for that? I'm studying it in lots of contexts, in sepsis, for deterioration, for clinical deterioration, for COVID and the treatment of COVID. Some of you, I think I sort of see faces from our session last year at AoM, where I presented some of that work. For in radiology, for cancer detection, particularly in breast radiology. So there are a whole bunch of for remote, taking in data from remote patient monitoring devices and finding and drawing out analytical insights that cross occupational jurisdictions for helping providers know how to use that avalanche of data to kind of draw out insights and treat patients more effectively, particularly in the areas of maternal fetal medicine and hypertension. So these are some of the areas. I'm going to stop now and turn it over to Michael.